Hello, my name's Jeremy Beckworth, and we're going to be talking about light as medicine, a very fascinating topic. We're going to break this down into three sections. First, we'll talk about UV exposure, visible exposure, and then infrared, and the benefits of each of these, and the risk as well. So if you look at the wavelengths, from right to left, you have radio waves, microwaves, infrared, and these are longer wavelengths. Then you get into the visible light spectrum, ultraviolet, A, B, and C, X-ray, and gamma rays. So on this left side, from ultraviolet to gamma rays and X-rays, they are shorter wavelengths, higher energy, and they are ionizing radiation, which has the potential to cause cancer. The longer wavelengths have lower energy and are non-ionizing. You have the near infrared here and the far infrared with longer wavelengths there. So what are the benefits of UV? As we start talking about that. So the two big ones would be vitamin D and nitric oxide. Other question, is it UVA or UVB that helps you make vitamin D? Well, it is UVB that helps you make vitamin D. And interestingly, which one of these is blocked by windows? So if you're sitting inside a home or inside your car, a glass actually blocks UVB. So you're not able to make vitamin D if you're sitting inside your home or inside of a car with the sun coming through there. You still get UVA rays, but not UVB. So can you make vitamin D without the sun? The answer is no, you can't. You have to have the sun, although of course you can supplement vitamin D without sun in a capsule form. But to make vitamin D, the sun, UVB rays we talked about, hits the skin, and superficially there's a cholesterol-like substance in the epidermis that interacts with the UVB rays to make vitamin D3. It is then carried in the bloodstream to the liver to make 25-hydroxy vitamin D. And then it goes to the kidneys to make 125-dihydroxy vitamin D. And when you check your blood work, it's actually this 25-hydroxy vitamin D that is measured in the bloodstream. The active form is the 125-hydroxy vitamin D. So what are the benefits of vitamin D? And we always think of it helps uptake of calcium for bone strength, but it really has a number of benefits within the body. And we're just going to highlight a few of those. So vitamin D is a fat-soluble vitamin, and because of that, it can penetrate the lipid membrane of the cell and actually get into the nucleus, and it regulates gene expression. It's thought to regulate over 200 genes. So it is very potent. It binds to the vitamin D receptor and can act as a hormone. It can act in different cells throughout the body by gene regulation. So why do people get sick in the wintertime? Is it because we're all together, not the fresh air? What is it about wintertime that we tend to get sick? Is it that we're indoors, family gatherings? If you look at the peak year for influenza over about a 40-year period, the months of each year that had the highest incidence of flu tended to be around the winter months, as we already know this. From December to March would be the peak months for influenza. And if you look at this is influenza cases by year, you can see it definitely peaks here around the wintertime. This is right at December, January. You can see how it peaks around that time of year. So the question is, why does it peak at that time of year? As we mentioned, is it indoor gatherings, people getting together? Well, this is from the Harvard Kennedy School, and they looked at vitamin D levels and correlated that with influenza and found a relationship. As vitamin D went down, influenza went up. And their conclusion in this study from 2020, they found that sunlight strongly protects against getting influenza. How about in Australia? So Australia is in the southern hemisphere. Do they see peaks during the wintertime, like during Christmas time when they get together, family gatherings, or is it during the summertime when there's less sunlight and vitamin D? Well, if you look at the peaks in Australia, it's just the opposite of what we see here. It's during the winter, it's during the summer months, again, which is their colder season, that they see peaks in influenza. It's just opposite of what we see in the northern hemisphere. So it's not a family gathering thing because they still get together for Christmas and family gatherings, but it's a sunlight outdoor exposure thing. How about Singapore? Singapore is much closer to the equator, And if you look at the pneumonia, influenza rates, deaths from that, it's all over the place. There's not a set cycle. So it's not just flu that has a yearly cycle. Heart disease, cancer, strokes, chronic respiratory disease, Alzheimer's, diabetes, influenza, you can see they all follow a cyclical pattern where it peaks during the wintertime. And this is directly related to sunlight exposure. So the question is, what percentage of the U.S. has a normal vitamin D level if we use the cutoff of 30 nanograms per milliliter? Well, that is about 35%, meaning 65% of people have a low or suboptimal vitamin D level. And is 30 nanograms per milliliter ideal? Well, that has been well validated for bone health. There are systematic reviews, though, looking at all-cause mortality. This is a vitamin D level and then all-cause mortality. So all-cause mortality decreases until you reach right at that 100 to 125 level, which in the U.S. would be the 40 to 50 nanograms per milliliter. Similar with composite diseases, it tends to level off once you get to that 40 to 50 nanogram per milliliter. So 30 has been well validated for bone, possibly up to 40 to 50 for all-cause mortality. Again, less than 30 would be considered low, optimal either 30 or maybe up to 40 to 50. It should be noted you can get too much vitamin D. If you get over 100, around that range, it can be toxic. And so you want to be careful. Vitamin D is fat soluble and you can have toxicity from it. So how much vitamin D should you take? According to the National Academy of Medicine, 600 to 800 international units a day. If you're deficient or limited sun exposure, maybe 1,000 up to 5,000 international units a day. Of course, you want to check your levels so you don't get toxicity, because that is a real issue that you can have. So the NIH suggests how much time to get sufficient vitamin D. Well, that's 10 to 15 minutes if you have lighter skin. If you have darker skin, it's probably more time, around 30 to 60 minutes. And this is when your shadow is shorter than your height. So more when between 10 a.m. to 4 p.m. when the sun is overhead. And during the winter months, if you're above the 37th latitude, it's not possible to make enough vitamin D. So you really have to supplement when you're north of that. And if you're below kind of the Tennessee, North Carolina line, if you're like myself, sometimes I go to work in a Stark, I come home with Stark, I'm not getting enough vitamin D. And so vitamin D supplementation during the wintertime may be especially important. So the question is vitamin D best obtained through the sun or through supplementation? So this is one study looking at COVID-19 outcomes based on vitamin D deficiency, and those patients coming in with low vitamin D levels had higher risk of death and mechanical ventilation. And this is probably a better measure, not of supplementation, but of people who had been outside. And there are meta-analysis and systematic reviews showing there's higher mortality, greater severity, and more hospitalization in people who had low vitamin Ds. Again, probably a better measure of those who were not outdoors getting sunlight. And supplementation after getting COVID, there was more mixed results, although the biggest improvement was seen in those who were vitamin D deficient. So there was some in these systematic reviews and meta-analysis, some improvement of mortality and severity of disease, but the biggest improvement was those who were in vitamin D deficient. So probably best having good vitamin D levels through outside sunlight exposure. So beyond vitamin D, UV benefits go towards nitric oxide synthase. Here it says nitric oxide metabolites are abundant in the human skin. There's preformed cutaneous nitric oxide stores that are activated with UVA exposure. So blood pressure has been related to latitude, we think because of nitric oxide. And if this is the equator, the farther you go away from the equator, the more your blood pressure rises. And this was seen more pronounced in 1975 when medications for blood pressure were not as commonly utilized or available. Nowadays, the difference is not quite as notable because probably people are more managed on medications. But again, the farther you get away from the equator, the higher blood pressure, even up to a 10-point change back in 1975, when there weren't as many people on blood pressure medications. Additionally, similar findings with cholesterol. The farther away you get from the equator in latitude, the higher your cholesterol tends to be. So this was a paper from southern Sweden, looked at 30,000 subjects, 20-year follow-up. They looked at sun exposure, whether folks were categorized as either avoiding, moderate, or most active sun exposure. And mortality was 2 times higher in the sun avoiders. And they found that sun avoiders had a similar life expectancy as smokers. So that was a big takeaway news headline from this study. So mortality 2 times higher in sun avoiders, and sun avoiders had a similar life expectancy or as bad as smoking. So you look here, the risk of cardiovascular death, cancer, and other causes of death was highest in those who avoided the sun, lowest in those who got more sun exposure. This is from that same study showing a survival curve of those who got more sun exposure had a greater survival versus those who had less sun exposure had a worse survival. Similar study looking at 400,000 individuals from the UK Biobank. They had about a 13-year follow-up, and they looked at ultraviolet exposure and solarium use, which are these rooms that have windows in them and allow sunlight to come in. And whether solarium or outside exposure, the risk of death from all-cause, cardiovascular, cancer, or non-cancer deaths, they were all better. If one is neutral, like there's no benefit, these were all protective. So sun exposure was protective for all of these things. And they did, again, the big risk you were always concerned about is skin cancer with sun exposure. And there was a trend towards higher rates of melanoma, although, again, 1 is being neutral. So the confidence intervals crossed 1, meaning it was not statistically significant, but there was a trend towards higher rates of melanoma. Interestingly, the mortality was no different. And the incidence and the mortality of non-skin cancer, so other causes of cancer other than the skin, was improved. There was actually a benefit in those being out in the sun for mortality of all other causes of cancer. And so their synopsis or summary says, we have shown that an increased sun exposure correlates with higher, significant reduced all-cause cardiovascular and cancer mortality. So a very powerful statement. So in summary, with UV, the benefits are, we mentioned vitamin D and nitric oxide. We mentioned why people get sick during the wintertime. And we talked about optimal levels for vitamin D, and also the idea of you can get too much vitamin D through taking too much capsules or tablets of vitamin D. You don't want to overdo it. It is fat soluble and can cause toxicity. So we have covered the topic of the benefits of UV. Now we're going to move on to the visible spectrum. What are the benefits of visible light? Well, the circadian rhythm is one of the big things we will mention here. It turns off melatonin and it turns on your cortisol levels when you get light exposure. So as light comes in the eye, the lower part of the retina has these intrinsically photosensitive retinal ganglion cells that then will activate the pineal gland to shut off melatonin. And then there's a production of cortisol as well when light comes on, and just the reverse happens when it's nighttime. So what are the downsides of night shift work? So the published data has suggested that you get less sleep time, poor quality of sleep, increased insulin resistance, increased risk for type 2 diabetes, increased appetite and weight gain, a decreased immune function, higher blood pressure, heart disease, stroke, decreased alertness and memory, increased depression, anxiety, and actually the World Health Organization classifies night shift work as probably carcinogenic, a class 2A carcinogen. How about the evening use of light-emitting e-readers, something like a Kindle or an iPad to read versus a book? So this is signifying ebooks, the irradiance, exposure to light, versus a regular printed book that you don't get really much exposure. And they looked at sleep latency, how long it took to go to sleep after using an ebook versus a regular book. And you can see it took longer, more time in minutes to fall asleep than it did if you're using a regular book. So ebooks, light exposure decreases your ability to fall asleep. This was a study from the UK Biobank where they wore 88,000 subjects and there was a light sensor on their watch. They followed them for 8 years and they tracked mortality. And what was interesting is that light at nighttime, if one is neutral here, there was increased cause of mortality for people who got nighttime light exposure. Just the opposite, light during the day caused a decrease in all-cause mortality. So light is very powerful. If you get it at the right time, it's helpful. If you get it at the wrong time, it can be very harmful. So what is the ideal? You want to avoid light at nighttime. 2 hours prior to going to bed, you try to avoid blue-rich light, such as phones, tablets, TVs, LEDs, bulbs. Those are potent melatonin suppressors. Melatonin levels drop 70 to 100% during light exposure and remain 50% below baseline for at least 50 minutes. If you're going to use light, warm red lights are preferable below your eyes rather than overhead because it's those retinal cells at the bottom that turn off melatonin and turn on melatonin. Dark room at nighttime for sleep is important. Light at nighttime has a lot of negative impacts. It disrupts the sleep. There's muscle loss, bone loss. Cortisol levels are higher and testosterone levels drop by 24%. So what should we be doing in the morning? Sunlight before 9 a.m. for 10 to 30 minutes. It helps with earlier sleep onset, better sleep quality, less fragmented sleep, more alertness the next morning. It anticipates an earlier sleep time. If you are like me, sometimes I go to work when it's dark and come back when it's dark, especially during the winter months. So the other alternatives, you can do a 10,000 lux lamp for 20 to 30 minutes. And the studies suggest about 16 to 18 inches in front of your face. Alternatively, you can do blue light glasses that are at the 470 nanometer blue light range for 30 minutes or more every morning. And that has a similar benefit as getting outside in front of the sun, which again turns off the melatonin, turns on cortisol, lets you know that it's time to start the day. So these are the different options. Sunlight can be up to 100,000 lux is really the most effective. You can do light boxes that are around 10,000 lux. And there's these glasses, AO glasses, that are not quite as bright, but they're right in front of your eyes, and they can be very effective as well. Indoor lighting, not an effective way to reset your circadian rhythm. So light is known to activate gonadotropin-releasing hormone, which then activates the luteinizing hormone and follicle-stimulating hormone, which then activates the sex hormone. So in guys, that would be testosterone, and females, estrogen or progesterone. So this was an interesting study looking at luteinizing hormone following light exposure in healthy young men. Again, luteinizing hormone is the precursor to testosterone, and they put them in front of bright light, which was 1,000 lux, so not even a 10,000 lux light box, versus a dim light placebo. And they did this for 5 days for an hour in the morning, 5 to 6 in the morning. And what they found was that luteinizing hormone increased by 70% in those getting the bright light box at 1,000 lux. And so this would be an alternative if you have low testosterone to the prescription testosterone or topical testosterone, which does have known side effects. Similar study looking at females with a light box, 4,300 lux. Again, very similar, 45 minutes for 1 week, and versus a placebo. And the concentrations of LH and FSH were significantly increased and improved ovulation cycles as well. If you live on the eastern side of a time zone versus the far western side of a time zone, it has a health impact. You actually get 19 more minutes of sleep, improves cognitive performance, and improves cardiovascular health. So just getting light earlier in the day has a positive benefit. And that's been suggested as why daylight savings time is not a good thing. You think of when it springs forward in the springtime, sunrise goes from 6:30 in the morning to 7:30 in the morning, and that has a negative impact. And the American Academy of Sleep Medicine has recommended eliminating daylight savings time and adopting a permanent standard time. This is an interesting study looking at light versus depression or seasonal affective disorder, which is depression during the winter months. They compared light, 10,000 lux light, versus Prozac, an SSRI antidepressant for seasonal affective disorder. They both had a similar response, 2/3 of people having a clinically significant response. The only difference was that light worked more quickly within the first week, where it can take 3 to 4 weeks with the antidepressant. Similar studies showing the exact same results. This was with a 3,000 lux, 2 hours a day versus Prozac. So in summary, for the visible light spectrum, the benefits are the circadian rhythm effects. And we mentioned it's ideal to have a dark room at nighttime. In the morning, the ideal is to have light when the sun comes up. In the morning, it turns off melatonin, it spikes your cortisol, lets you know it's time to wake up, has a positive impact on the sex hormones. Living on the eastern side of a time zone, 19 more minutes of sleep, better cognition. And we looked at how light had a similar effect to an antidepressant for seasonal affective disorder. So now we'll move on to infrared, the benefits of infrared light. So infrared is in this wavelength. The near infrared is in the 700 to 2,500 nanometer. It penetrates into the mitochondria. It increases ATP, or energy production, within the mitochondria, and there's less oxidative stress. So how that happens, glucose comes into the cell, and to create energy, it's produced in the mitochondria. First, there's glycolysis that splits the glucose. It goes into the Krebs cycle and then the electron transport chain to produce ATP, or energy. And sunlight, through infrared radiation, penetrates into the mitochondria. It's absorbed by cytochrome C oxidase, which enhances electron transport, and that in part improves the proton pumping in the intermembrane space. And that gradient helps increase ATP production. And this process being more efficient, there's fewer free radicals that are left, less oxidative stress. So is melatonin, which plays into what we were just talking about in the mitochondria, is it a hormone of the day or nighttime? Well, we typically think it's a nighttime hormone because it bumps up the circulating levels from the pineal gland at nighttime when the room is dark, when we're sleeping. And this paper here, 2019, Melatonin and the Optics of the Human Body, it showed that the pineal gland produces much lower amounts, maybe about 5% of the melatonin in the body. You see it circulating at nighttime, again, produced by the pineal gland. But in response to near infrared, the mitochondria produces, in magnitudes much greater, melatonin. And melatonin is considered to be one of the most potent antioxidants in the body. So melatonin has a potent antioxidant effect within the mitochondria, and we know that there's mitochondrial dysfunction as we age. From age 20 to 70, there's upwards of a 50% reduction in the mitochondrial's energy capacity. There's less energy production with ATP. There's decreased electron transport chain efficiency, increased reactive oxygen species or free radicals, and increased DNA damage within the mitochondria. So it's all part of the problem with aging in the mitochondria. Here again, mitochondrial dysfunction, hallmark of aging, as this paper here states, mitochondrial dysfunction has emerged as one of the key hallmarks of aging. And this here paper saying the decline in human muscle mass and strength, or so-called sarcopenia, is a hallmark of the aging process. The mitochondria are at the center of this process. So the question here is, how deep does near infrared penetrate the body? Because that has a potent impact on the production of melatonin, and we talked about cytochrome C oxidase as well. Well, how deep does it penetrate? Does it get to the mitochondria? Well, it penetrates, according to Google, up to 7 centimeters. This paper here said up to 8 centimeters, or just over 3 inches deep, which is different based on darker skin versus lighter skin, but it's approximately upwards of 8 centimeters or 3 inches. Well, interestingly, this paper here, it was fascinating. Longer wavelengths in sunlight pass through the entire human body, which have a systemic impact on improved vision. And so they looked at the sunlight, specifically near infrared wavelengths, and they had a optical detector device on the other side of the body, and they found that it penetrated well deeper than 8 centimeters. It actually penetrated through the entire body, with small amounts of it getting through to the other side, which peaked at the wavelengths of around 800 nanometers. Those were the wavelengths that penetrated the deepest and actually penetrated through the body. So they took that information, and with that information, they designed this study. There was 3 groups, a control group and 2 treatment groups. The 2 treatment groups got near infrared at that 850 nanometer wavelength, which penetrated deeply. They did it just for 15 minutes, a single session. So these are 2 groups got that treatment. There was a control group that got nothing. This group got the near infrared both to the body and to the head. This group just got it to the body. It was blocked to the head. And then they looked at vision. The mitochondria are most dense on the back of the retina. And they noticed there was significantly improved vision when it was done to the body and head, but also when it was done just to the body, not even to the head, or when there was no eye exposure to the near infrared. So it had a local mitochondrial stimulation, but it also had distant mitochondrial effects because just stimulating the body had an impact on the vision. And this is change from baseline for protan or red color uptake, and blue. It was benefited both whether it was just to the body or the head and body. So the question is, does near infrared penetrate clothing? With all these benefits of near infrared, does it penetrate? We know it penetrates deeply through the body, but will it actually penetrate clothing? And the answer is yes, it will. This is the percentage of near infrared penetration from 100% down to 0%. And this is the number of fabric layers of different various things. Denim seems to block it the most, but with most clothing, you have to have numerous layers of clothing to actually block out the near infrared. So if you have clothing on, you're outside, you may not, it will block UV rays, but it does not block near infrared. And when you're sitting out in nature such as trees, shrubs, grass is highly reflective of near infrared. So you're getting near infrared exposure just sitting outside, even when you're not in the sun. So on a hot summer day, you can look at the temperature of the street or a building. It can be very hot because it very much absorbs the near infrared, which is the heat that comes from the sun. Heat from the sun is carried in near infrared wavelengths. But if you check the temperature of a tree or shrubs or grass, much cooler because they're very reflective of near infrared, and you get that benefit. You get the reflection when you're sitting out in nature of near infrared and all the benefits that it has. So this was a fascinating study looking how near infrared lowered glucose by 27%. And the reason, as we talked about, glucose comes into the cell, glycolysis takes it, and then Krebs cycle, and then electron transport chain. And near infrared makes this much more efficient. So in this study, they had a fasting glucose level. They ingested 75 grams of sugar glucose. One group got near infrared for 15 minutes, the other did not. And just with that intervention, there was much less bump, by 27%, I should say, of glucose. So there was a reduction in glucose level just by near infrared exposure. So fascinating study. So this was a systematic review and meta-analysis of 143 studies, and they looked at outdoor time. More green space outdoor exposure was associated with 28% reduction in type 2 diabetes, 16% reduction in cardiovascular mortality, and a 31% decrease in all-cause mortality, all-cause death. So the power of getting outside. So this is a study during the COVID-19 pandemic looking at deaths in the US, England, and Italy, and they looked at satellite-derived UVA or sunlight exposure and COVID-19 mortality data, adjusting for various confounders. And what they found that the higher the UVA or sunlight exposure, there was lower associated COVID-19 mortality. So it's really based on like where in the country you were. If you got more sun, there was benefit. Whether you're farther south seemed to do better because of the more UVA exposure or sunlight exposure. And as you can see here, this is COVID-19 deaths, and this is UVA exposure. So the more the exposure, the lower the death rates were, both in the US, England, and Italy. They stated in that paper that the effects appear independent of vitamin D. We know that vitamin D is important for your immune function and fighting off diseases, but it was independent of vitamin D. Another study looking at COVID mortality as it's associated with latitude, and they found there's a clear association with latitude. This is another study in January 2021 that looked at the COVID-19 surge dates in Europe during the fall, the preceding fall, and they looked at temperature, humidity, and latitude. There was no association with temperature or humidity, but the latitude was there was a clear link where the surge started in the northern countries and then progressed only later to the southern countries that had more sunlight. So this was a fascinating study during COVID-19 in Brazil, and they took 30 inpatients who had COVID-19. 15 got near infrared at the 940 nanometer range, and the other control group had a sham vest that was left off. And so this was 15 minutes per day, once a day for 7 consecutive days. And because this is in the invisible spectrum, neither group knew if they were getting the real treatment or the sham treatment. And what they found, this is what it looked like. This is from the paper. This is the vest that they used there in Brazil in this paper. And what they found was the length of hospital stay was a full almost 4 days shorter in the near-infrared group. They had improved oxygen saturation, improved respiratory rates, improved lymphocyte counts, and overall clinical improvement. So in a randomized, blinded study, there was clear benefit for near-infrared, especially with hospital length and clinical outcomes. So this was another fascinating study. It's an animal study, but very powerful nevertheless. It was looking at near-infrared light and how it reduces neuroinflammation in a mice study. Granted, not humans, but still, they had mice that were fed a regular diet versus a high-fat diet, and then each of those groups were either given a sham treatment or near-infrared treatment. So regular diet versus the high-fat diet. So the high-fat diet with the sham treatment, you can clearly see that there's increased markers of inflammation compared to baseline. But if they were given near-infrared, the markers of inflammation dropped notably, almost down to the regular diet. So high-fat diet, pro-inflammatory within the brain, but near-infrared lowers that quite notably. And they also looked at, so another fascinating thing they looked at in the study was BDNF, or brain-derived neurotrophic factor, and how it was increased by near-infrared. Brain-derived neurotrophic factor, BDNF, supports the growth and maintenance of neurons in the brain. It helps neuroplasticity, plays a key role in learning and memory, helps the brain recover from injury and stress. And if you look here, this is the regular diet, this is the high-fat diet. So the regular diet, when there was sham versus near-infrared, it bumped up the BDNF a little bit. But if you had eaten, the animal had eaten a high-fat diet, clear decrease in BDNF levels that then bumped up significantly after near-infrared treatment. So a fairly potent impact on BDNF by near-infrared. You can see there. So this was another powerful study looking at sun exposure and how it's linked with gray matter volume and whole brain volume in the setting of multiple sclerosis. They divided sun exposure during the summer months to lowest to highest quartiles, and the higher the quartile was, the higher the gray matter volume and whole brain volume. So it was beneficial sun exposure to brain volume and mass. There are many studies looking at recovery within a hospital after surgery, and if you have a room with a window, you do better. Many studies have reported that. And this used to be done commonly, getting outside. The benefits of being outside has been known for quite some time. This is over 100 years ago at the Battle Creek Sanitarium, showing people getting outside or people coming on the balcony to get fresh air, a little sunshine. This is, again, the Battle Creek Sanitarium. John Harvey Kellogg, 1894, over 100 years ago, they were using these light boxes. This is a different hospital I saw online in Colorado where they put people outside for treatment. So this has been known for quite some time. Studies are just coming to show what people were doing over 100 years ago. So this is a powerful case study. I got this from medcram.com, Dr. Roger Soholt. And so I'd refer you to that website and his YouTube page, medcram.com. But this is a 15-year-old patient who had been diagnosed with leukemia, had started chemotherapy, developed an opportunistic infection. CT scan showed a pneumonia, and it ended up being an aggressive form of a fungus. and the patient was placed on strong antifungal medications. But unfortunately, this is in June, he got this. He was not responding to the antifungal medications. The CT scan end of June showed necrotic tissue. There was no blood flow getting there. They had to remove his left lung, only 15 years of age. And so they did that, took him back to the ICU. But unfortunately, he continued to worsen. And they did another CT scan. This CT scan, this is the left side. This is the right side. This is the orientation of a CT scan on their back, feet coming towards you, which makes this the left side. This is the right side. You see this left side, the lung has been removed. There's this fluid in the cavity there. The right side, there's also a lot of fluid from the fungus. Only one portion of the lung was there actually air for oxygen exchange in the lower portion of the lung. And so they had a team conference, and they decided this was not looking good. They couldn't take out the other lung. There's really nothing. Patient was not responding to antifungal treatments. Everything was not looking good, and they made the patient a do not resuscitate, and they told him he had probably about 2 days left to live. So they asked him, what would you like to do? He'd been in the hospital a month and a half now, and he expressed a desire to go outside. This is July 16. So they got him outside. So here's what transpired. He went out on July the 17th for 4 hours, 2 to 6 p.m. He's febrile, had a fever, had an elevated white count and neutrophil count. Went out for 4 hours. The 18th, actually his fever was gone, amazingly. His white count was coming down. Neutrophils were coming down as well. By the third day, he'd gone out that day just for an hour, but his fever was gone. His white count had normalized, and they were like, what is going on? He went out for the fourth day, and they decided, let's repeat the CT scan, July the 22nd. It's 5 days later. And what did they see? This is what they had seen previously. You can see fungus filling the lung cavities on the right side, and then the 22nd, they had sun, and you can see marked improvement of clearing of the fungus. So quite impressive. The only thing different was that he had gone outside. So the power of getting outside. Again, this is not a randomized controlled trial. It is a case report. But the only thing that was different after they'd given him 2 days to live was that he went outside, and it helped. You can see here, much more clear lung that had been filled with the fungus, and he was able to be discharged home. This is a year later. And so the power of near-infrared. The only problem is near-infrared exposure has decreased over time. This is near-infrared in the 1800s, 1950s, 1990s, and present, how there's been a marked decrease in exposure. 93% of our time is spent inside, and we get very little exposure to near-infrared. So not only that, the light bulbs we use now are the LED lights, which are very efficient, but they're only in the visible light spectrum. There's no near-infrared exposure, whereas our old incandescent light bulbs that we used to use, not energy efficient, but it was in this near-infrared spectrum, plenty of exposure there. But now that is no longer. So we're spending more time inside. Even the lights we use inside do not have near-infrared. Additionally, the glass that we use now are these low E glasses that are energy efficient during the winter months and summer months. And you can see if this is the target range we want for near-infrared exposure, low E glasses allow visible light in, but the near-infrared is much of it is cut out. And so not only are we not getting outside so much, and our light bulbs cut out near-infrared, but now our glasses do that as well in our homes. So in summary, we talked about UV light, visible light, and infrared light, and the benefits of all of these. And most of us get very little time outside. So what should we be doing? We should get sunlight, 10 to 15 minutes for lighter skin, 30 to 60 minutes for darker skin, for adequate vitamin D synthesis. 1 hour outside. This does not need to be in direct sunlight. You can have long sleeve clothing, wide brim hats, etc. You could be sitting in nature, which is highly reflective of near-infrared, which has a powerful impact. We talked about how mitochondrial dysfunction is the hallmark of aging. First thing in the morning, it's ideal to get sunlight for 10 to 30 minutes before 9 a.m., ideally even when it's first coming up. If you are like myself, go to work early, light boxes for 30 minutes, or these blue light glasses, AO blue light glasses or others for 30 minutes will help set your circadian rhythm. And a dark room when you go to sleep, hugely helpful to have a completely dark room so it doesn't throw your melatonin off. And you want to avoid light prior to going to bed. The ideal is 2 hours before. I know that can be a hard thing to do, but that is a quick summary. Thank you so much.